It's cancer, a phrase that nobody ever wants to hear. But unfortunately, a majority of us have had cancer touch our lives in some form. So today I am going to talk a little bit about the most common form, skin cancer. According to the Skin Cancer Foundation, skin cancer is the most common form of cancer in the United States, with more than 3.5 million cases in over 2 million people diagnosed annually. Over the past 3 decades, skin cancer has affected more people than all other cancers combined. Did you know that 1 in 5 Americans will develop skin cancer in the course of a lifetime? That means one of us in this room could possibly develop this disease. There are 2 forms of skin cancer. The most common form is known as basal cell carcinoma, and an estimated 2.8 million cases are diagnosed yearly in the United States. The second most common form is called squamous cell carcinoma, with an estimated 700,000 cases diagnosed annually in the U.S. The Skin Cancer Foundation states that between 40 and 50% of Americans who live to the age of 65 will be diagnosed with either one of these forms at least once. Melanoma is the third and least common form of cancer, although its incidence is increasing. 1 person dies from melanoma every 57 minutes. The Illinois Department of Health states that most basal cell and squamous cell carcinomas are caused by ultraviolet radiation produced by the sun. They also list some other factors, including race. People with fair skin, freckling, or red or blonde hair have a higher risk. Moles. There are certain types of moles that increase the chances of getting melanoma. Family history and exposure to chemicals such as arsenic are other factors. And radiation treatment. This increases the risk of developing non-melanoma skin cancer in the area that was treated. Many skin cancers develop in areas where they can be seen, which means there is a good chance of catching them early on. Basal cell carcinomas may appear as a pale patch of skin, a waxy translucent bump, or a brownish scar or flesh-colored lesion. Squamous cell carcinoma may appear as a lump on the skin that is rough on the surface. It could also appear as a reddish scaly patch that doesn't go away and continues to develop slowly. Melanoma signs may include new spots on skin or a change in size, shape, or color of an existing mole. The ABCD rule is a way to recognize abnormal growths. A stands for asymmetry, which means an irregular shape or 2 different looking halves. B is for border, irregular, blurred, rough, or notched edges. C for color. Watch for changes in shade of the mole or distribution of color. D for diameter. Moles larger than 1/4 inch may be suspect, although some melanoma can be smaller. Fortunately, skin cancer is very treatable and preventable. Here are a few things you can do to help prevent you and your family from developing skin cancer. Avoid too much exposure to the sun and other sources of UV radiation. Protect your skin with clothing such as loose-fitting long-sleeve shirts and hats. Use sunscreen with an SPF of at least 15, applying 20 to 30 minutes before exposure and reapplying every 2 hours. Wear sunglasses and avoid tanning beds or sun lamps. People who suffer severe sunburns in their early childhood and teenage years are at an increased risk of melanoma, so protect your kids. I hope everyone has learned something, and remember that it's never too late or too early to start protecting yourself and your family. For more information, you can visit www.skincancerorg.com or www.cancercenter.com. Thank you.